Hello everyone. This presentation is on Xing Tang, also called ephedra, apricot kernel, gypsum, and licorice decoction. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Xing Tang belongs to the category clear heat. A representative pattern is lung heat with cough, wheeze, fever, and thirst. Important ingredients include ma huang, Xing ren, shigao, gan cao. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 45-year-old woman with wheezing cough after medical evaluation, history of asthma, and hypothyroidism. The current medicines are albuterol inhaler, levothyroxine, hydrochlorothiazide. This case gives a possible reason to consider Xing Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is ma huang plus albuterol. The mechanism is that additive sympathomimetic effects can increase tremor, heart rate, and blood pressure. The clinical significance is moderate to high. My management plan is use caution in asthma patients already relying on beta agonists. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is shigao plus levothyroxine. The mechanism is that mineral-rich substances can reduce absorption of some oral drugs. The clinical significance is clinically relevant for levothyroxine because absorption consistency matters. My management plan is separate levothyroxine and the herbal formula by several hours. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is gan cao plus hydrochlorothiazide. The mechanism is that licorice can lower potassium and increase sodium retention. The clinical significance is moderate. My management plan is check blood pressure and potassium and avoid excessive licorice exposure. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Xing Tang may be reasonable when the patient truly matches the pattern lung heat with cough, wheeze, fever, and thirst. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.